leaving. My partner and I were called to a house at 204 Maxfield Avenue, Kingston, for a patient experiencing abdominal pain. My scene is safe. BSI for me and my partner. Number of patients is 1. I'm going to put ALS on standby. My general impression of the patient. See adult female laying prone. Seem to be experiencing abdominal pain. And I see liquid on the ground. Put patient in the line of sight. Ma'am, if you can hear me, do not move your head. The controller C-spine. Ma'am, can you hear me? Patient groans. We are going to do a control lag roll, but before we do so, I'm going to ask my partner to do a quick check at the back to see if there is any injury. We're going to expose the patient's back. Ma'am, we're going to expose the back to do some checks here. And my name is Daneil Brown. My partner and I are from the Jamaica Fire Brigade Medical Services.
Sounds clear.
My partner report that the lungs sound are clear and there is no injuries to the patient's back. We're now going to do a control lab roll of this patient. Ma'am, we're going to roll you to do some further checks, okay? We're going to roll the patient. 1, 2, 3. Now, I'm going to ask my partner to come and take over C-spine. My patient, ma'am, can you hear me? She respond. Can you say why you call EMS? She said that she feeling abdominal pain. She felt a sharp pain to her abdomen and she went down. I'm going to now move on to my assessment. Ma'am, I'm going to do some checks on you to find out if you're okay. If you're okay, all right? Patient gave me consent. Patient spoke to me, so her airway is clear. I am now going to do my breathing assessment. Patient is breathing at 24 breaths per minute. There is bilateral rise and fall of the chest with adequate depth. Lung sounds are clear. That's O2 sat. Patient has a O2 sat at 92% and room air. I am going to put this patient on nasal cannula at 4 liters. But before I do so, I'm going to do a rapid scan of this patient. The patient said that it did not fall, but I'm going to do my checks first. I'm going to do some checks on you, okay? Patient reported to me that she didn't fall, but I am ruling out a distracting injury. And I see no injury, and the patient reported to me that she didn't fall, so at this point in time I'm going to rule out trauma. I'm going to ask my partner now to let go of the head and go and attach the oxygen via nasal cannula. I'm now going to move on to my circulation. Mama, I'm just doing some checks on you to ensure that you're okay, alright? Patient has a pulse rate of 104 beats per minute. There's strong pulse bilateral. Capillary fill is delayed 3 seconds. Patient's incontinence is cool and clammy. At this point in time, I'm going to treat for shock. Mom, I'm going to put a blanket over you to keep you warm. At this point in time, this patient is alone and go. Put her in the back of the ambulance, and she's talking to me at the moment, so I'm going to try and hurry up and get a history of this patient before I move on to secondary assessment. Patient reported, alright, so the signs, the patient reported that also that when she was standing, she felt a sharp pain in her abdomen, and she felt a gush of fluid. It looks to be urine. So at this point in time, I make a note of that, and I am going to continue. So signs, patient the urine on the ground, patient having abdominal pain, and also the patient is showing signs of shock. So I am going to move on to allergies. The patient says she's allergic to any medication. The patient is on medication. It reported to me that she is on medication for hypertension and diabetes, but she is non-compliant with her medication. Pertinent history: patient is hypertensive and diabetic, and the patient last meal was yesterday at 9 p.m. and that was about 12 hours ago. So at this point in time, the patient reported to me that she's diabetic. I am going to now do a head to toe assessment. The patient, I'm going to check the patient abdomen, palpate the patient abdomen. Patient reported to me that I lower right quadrant, upper right quadrant, left upper, left lower. Patient is guarding, so that means she's feeling obvious severe abdominal pain, and she said it's feeling all over. So at this point in time, I'm going to ask her to describe the pain for me. She said that the pain is a stabbing pain, and it started about half an hour ago, and that's why I showed on the floor. I asked her what makes the pain better or worse. She said nothing makes it better, nothing makes it worse. It's just constant. Quality of the pain, she said it's a stabbing pain to her abdomen, but mostly around the bladder area. The pain radiates. The patient says no, it's just in her abdomen alone she feels the pain. Severity, the patient reported that it's a 10. It's a 10 out of 10, and it's constant. At this point now, I'm going to ask my partner to help me do a set of vitals, starting with the pupil, and I will do blood pressure. So my partner is going to do things I'm going to do. Mom, I'm going to do some more assessment on you. We're going to check you. So as we go along, we're going to tell you what we are doing. We're checking your eyes to make sure that everything is okay.
Pupils pearl.
Make a note of that.
GMR. I'm going to feel a little prick on the finger, okay?
The patient is diabetic and non-compliant, so I'm going to ensure that the GMR is okay.
GMR reading is 1.6.
GMR reading is 1.6. So at this point in time, I am going to assume that this patient is is having a diabetic emergency and is hypoglycemic. I'm going to continue my vitals. Patient have a blood pressure reading of 170 over 102. At this point in time, I am going to contact medical control to ask permission to give this patient glucose paste because she's conscious and alert. So I am going to administer glucose paste orally so I control medical condition control 54-year-old female complaining of abdominal pain, non-compliant with her medication, GMR reading of 1.6, blood pressure of 170 over 102. I gave the patient oxygen via nasal cannula at 4 liters, and I'm going to ask for permission to give this patient glucose. I'm giving permission. I apply the glucose. Ma'am, I'm going to put that paste in your mouth, and I apply the paste, and then I'm going to. Hospital is about 20 minutes away, so I'm going to reassess every 5 minutes. At my first reassessment, patient, I'm going to do back my breathing. Patient now is breathing at a rate of 18 breaths per minute. Bilateral light rise and fall of the chest, adequate depth. Patient pulse rate now is at 96%, and 96% with the nasal cannula. I am going to upgrade the nasal cannula to a rereader at 10 liters. Patient, I'm going to check up the patient GMR in the next 5 minutes. I do so. The patient have a GMR reading now at 4.2. Still cause of concern. I am going to reach hospital, and I'm going to also call ALS, and they say that they are stuck in traffic and they are unable to intercept. So I'm going to go to the hospital, hand over this patient, 54-year-old female, complaining of abdominal pain. The patient complained that the pain at first was 10. Upon giving her glucose paste and oxygen, it dropped to a 6. And the patient is now more coherent than before, and I'm going to hand over this patient. Thank you.